Good morning, everyone. I'm Ann Mazer, CEO of EveryMind. On behalf of the organization, I welcome you to our legislative briefing this morning. A bit of housekeeping before we get started. Today's briefing is being recorded and will be sent to you after the event. Attendees will not be seen or heard during the event. Please use the Q&A feature to submit questions. Questions will be answered between 10 and 10:30 a.m. during the Q&A portion of our program. Resources will be shared throughout the program in the chat. And don't forget to engage with us on Facebook, Twitter, Instagram, and LinkedIn at EveryMind Inc. I'd like to start by thanking the generous funders of EveryMind's crisis prevention and intervention services that make this work possible. Montgomery County Government, Montgomery County Public Schools, the Greater Washington Community Foundation, Sharing Montgomery Fund, Link to Health, Maryland Governor's Office of Crime Control and Prevention, Vibrant Emotional Health, Adventist Healthcare, and the J. Willard and Alice F. Marriott Foundation. Since our founding 65 years ago, EveryMind has been committed to the mental health and well-being of our community. Our roots are in Montgomery County, Maryland, but over the course of 6 decades, we have emerged as a trusted mental health resource, expanding to serve most of Maryland and the National Capital Region. From young children through older adults, our services offer a continuity of support throughout a lifetime. Today, our conversation is focused on hotlines specifically. EveryMind's hotline has been serving the community for 51 years. True, hotlines provide crisis intervention, but we must remember that they are a source of prevention. Psychologists and social workers themselves reach out to our hotline when concerned that some of their clients might be thinking of suicide. Our hotline works closely with other community partners, Montgomery County Public Schools and private schools, veteran-facing programs like Serving Together, those supporting older adults like Friendly Visitor and Representative Payee, homeless outreach services, and the many nonprofit partners in the health and human services space. All these supportive services are a critical part of crisis prevention. At a time when we have a national mental health crisis that is disproportionately affecting our youth, free and equitable access to supportive listening, resources, and crisis intervention is critically important. We have an amazing lineup of speakers today who are champions in this work with us, including a panel of hotline directors from across the state of Maryland who are on the front lines 24 hours a day, 365 days a year to support our community. Our opening remarks today will be provided by Congressman David Trone, who was elected in 2018 to serve Maryland's 6th congressional district, which includes all or part of Montgomery, Frederick, Garrett, Allegheny, and Washington counties. He serves on the House Appropriation Committee, Veterans Affairs Committee, and the Joint Economic Committee, where he is fighting to make progress on issues that matter to Marylanders, including the opioid epidemic, criminal justice reform, mental health, and funding for medical research. Congressman Trone earned his bachelor's degree from Furman University and an MBA from the Wharton School of Business. He was in graduate school that he opened his first store selling soda and beer that eventually grew into business with more than 200 stores in over 25 states and 10,000 employees, 800 of whom work here in Montgomery County, Maryland. Congressman Trone is a strong advocate for children and youth, recently urging House and Senate Appropriations leadership to prioritize funding for programs to address the youth mental health crisis and the severe shortage of school-based mental health professionals. Supporting community mental health is a priority as he represents his constituents. But before we hear from Congressman Trone, we'd like to share a video highlighting the impact of our hotline and the importance of the work that is done by call specialists on a daily basis. Thank you.
Lifeline, this is Arnold. What's on your mind today?
started just as the pandemic was hitting, when people were feeling really isolated, including myself. I just wanted to be able to make that connection and give back to Montgomery County. So I called on all the skills that I had learned to build rapport with her and to let her know that this was a safe space, that she could talk to me. Really, bit by bit, talked with her, asked her simple questions that she could answer and that she was comfortable answering, so she knew that she could tell me what she needed. So once my partner told me that the police were on their way, I stayed with the child to keep her calm and to keep her mind off of things, talk about things that she liked, school, activities, all of those things. I also realized that the police officer seemed really traumatized by what was going on. So I checked in to see how they were doing. And they shared that what really struck them was that they too were a parent. So why do I keep coming back, especially after calls like that? It's because I know I make a difference. And they help me too. I've learned so much about the resilience of people who are facing incredible mental health challenges, other challenges in their lives. And they teach me how to survive.
Hi, everyone. I'm Congressman David Trone from Maryland's 6th District. I'm honored to be speaking at EveryMind's legislative briefing to highlight the importance of a nationwide 3-digit crisis hotline. In Congress, mental health is a top priority of mine. And as a co-chair of the Bipartisan Addiction and Mental Health Task Force, I'm acutely aware of the impact COVID-19 has had on Americans. We've all seen the negative consequences that come with an increased sense of loneliness and isolation. Folks are struggling now more than ever. That's especially true of our country's youth. The statistics are really startling. The CDC recently reported that the number of children visiting the emergency room because of a mental health crisis has risen 24% for kids between 5 and 11. And for those between 12 and 17, over 31%. The evidence is clear. This nationwide hotline could not come soon enough. The 988 hotline is a no-cost option that includes help from specialists who are trained to assist folks of all backgrounds. It's mission critical that we provide equitable access to mental health resources for our youth, our LGBT plus communities, and our communities of color, which is why I'm proud to work with EveryMind to provide funding for its efforts to do just that. For 50 years, EveryMind has stepped up to care for those in its community and fight for our shared effort to break the stigma around mental health. We've really got to work together to address this mental health crisis in our country. It's all hands on deck. This hotline will deliver help to those who need it most, and it's without question, it will save lives. But our work isn't done yet. In Washington, I'm working to push my bill, the Comprehensive Mental Health in Schools Pilot Program Act, over the finish line to fund mental health and behavioral health programs in our schools. We need to teach our kids that asking for help is okay, and it's nothing to be ashamed of. The Bipartisan Addiction and Mental Health Task Force is doing great work to address both the mental health and opioid crises from all angles. Our agenda includes over 70 bills to help Americans in every corner of this country. These bills were all informed by organizations like EveryMind, who are on the ground every day, and who inform me and my team about what their communities needs are, and then how we can help in Congress. It's a team effort through and through. And I'm hopeful we can get a lot of work done this session. We've got to just keep fighting. I'd like to take a moment to thank again EveryMind for having me here today. Please keep up the good work. Take care, and of course, be safe.
Good morning. My name is Deepika Chen. I'm a manager at Crisis Prevention and Intervention Services at EveryMind. Together with our team of 72 certified volunteers and staff, we answer calls, chats, and texts from Marylanders through the National Suicide Prevention Lifeline all day, every day. Suicide thrives in silence and isolation. A more easily accessible lifeline through 988 will combat both of these conditions. According to the CDC, suicide consistently ranks second as the leading cause of death for Americans between the age of 10 and 35. Over 45,000 people were lost to suicide nationally in 2020. That is more than 45,000 families and communities devastated by the loss of a loved one in just 1 year. An easy to remember number to access our life-saving services cannot come soon enough. As you saw in Terry's story earlier, Lifeline crisis specialists are uniquely trained on how to talk to individuals in distress and to support them through crisis. At EveryMind, crisis specialists have to pass through a vigorous 80-hour training program in mental health and suicide prevention. Only the most qualified make it through. It is worth noting that most graduate and postgraduate programs for mental health professionals do not require any training on suicide. In fact, it is not uncommon for us to hear from suicidal individuals who are referred to us by their mental health providers for support. Lifeline's incomparable availability allows people who are struggling to reach out for help at any time, at any place. Regardless of your ethnicity, gender identity, sexual orientation, level of mobility, religion, or viewpoint, you will find help in our free, non-judgmental, and confidential services. Callers, chatters, and texters do not have to worry about health insurance or transportation. Through a simple phone call or text message, 988 users can rest assured they will be connected to someone empathetic and caring, who will treat them equitably and respectfully. We all know stigma associated with mental health is still a big barrier to treatment. It is hard to imagine a more powerful vehicle to destigmatize mental health conditions than to have a designated 3-digit number for emergencies, just as we have 911 for medical and other crises. In fact, over 90% of calls we receive do not result in emergency services being contacted. Lifeline centers provide a much more cost-effective and less traumatizing resolution for many in their darkest hours. Thanks to the tireless dedication from our volunteers and staff on Lifeline, not only does Maryland have one of the nation's lowest suicide rates, we are also a pioneer in providing community-based mental health hotline service. Here at EveryMind, for example, we've been answering calls from residents in and around Montgomery County for over half a century. We have stood by our local community through good times and bad times. When something traumatic occurs, like the recent shooting at Magruder High School in Rockville, Hotline hears from those who were affected and seeks support within hours. Indeed, Hotline is the canary in the mental health coal mine. It alerts the entire system of looming mental health crises, allowing providers to better prepare for what's to come. However, throughout the pandemic, the 8 Maryland Lifeline centers have been stretched to their limits to meet the escalating mental health demands in our communities. At EveryMind alone, the number of calls, chats, and texts we answered went up 30% since the time COVID hit our shores. On top of this, we are expecting a minimum 3-fold increase in call volume as 988 goes live in July. Your local Lifeline centers simply cannot meet this challenge alone. We are asking for your help. With support of the Maryland Senate and House of Delegates, government agencies, and the executive branch, Maryland Lifeline centers will rise to the occasion and make sure no cry for help ever goes unanswered. And now it's my pleasure to introduce our keynote speaker, Dr. Richard McKeon. Dr. McKeon has spent most of his career working in community mental health, and in 2009, he was appointed by the Secretary of Defense to the Department of Defense Task Force on Suicide Prevention in the Military. He has served on the National Action Alliance for Suicide Prevention Task Force and participated in the development of the WHO's World Suicide Prevention Report. He is currently Chief for Suicide Prevention at SAMHSA, where he oversees all branches of suicide prevention activities, including the National Suicide Prevention Lifeline. Now over to you, Dr. McKeon.
Thank you so much. It is a pleasure to be with all of you today to talk with you about 988. So I want to thank EveryMind for inviting me, to everyone who's participating in this meeting. And in particular, I want to thank all of the crisis centers who answer calls for the National Suicide Prevention Lifeline in the state of Maryland, several of whom you will be hearing from today. So I am going to give you a quick update on where we stand with 988, including why it was established. You can move on to the next slide. As was spoken about just previously by both of our previous speakers, too many Americans experience suicide and mental health crises without the support and care, that they need, including a completely unacceptable number who died by suicide, many of whom were not able to get any help prior to their tragic death. The National Suicide Prevention Lifeline is not new. 988 is being built on the foundation of the existing National Suicide Prevention Lifeline, which has existed since 2005 and has helped millions of individuals in emotional distress. SAMHSA has funded numerous evaluations that have shown reductions in suicidal thinking, as well as that callers to the Lifeline have experienced the calls themselves and follow-up calls from the centers as being life-saving, as helping them not kill themselves. You can go on to the next slide. So the journey toward 988 began with the National Suicide Hotline Improvement Act. And in that act, SAMHSA, my agency, and the Veterans Administration were asked to assess the feasibility and advisability of a 3-digit number for suicide prevention and to make recommendations to the Federal Communications Commission. We did that, and we indicated that we thought a 3-digit number could potentially be transformative to mental health crisis care and suicide prevention in the United States. In October of 2020, Congress designated the new 988 dialing code and determined that it should be operated through the existing National Suicide Prevention Lifeline. So all 988 calls will flow through the infrastructure of the existing lifeline. So that means that call centers to get 988 calls would need to be members of the National Suicide Prevention Lifeline. The Hotline Designation Act also did other things. It required reports on the resources necessary for 988. And there's a report on the SAMHSA website regarding that. What's called geolocation. The FCC did a report. And it also allowed states to institute cell phone fees to support 988 operations. More recently in November, the FCC ordered texting to 988 to be facilitated, and both calls and texts must be made available by July 16th, 22. If you on your cell phones, most cell phones have already made 988 active, but texting is likely not active on your phone as of right now. We will not be highlighting the availability of 988 until we get to July of 2022, because while significant numbers of Americans still don't have access, we don't want to be promoting that. But by July, all cell phones, all landlines, all voice over internet devices should have made 988 accessible by order of the FCC. But as has been mentioned previously, we're anticipating a significant increase in calls, chats, and texts with the easier accessibility of 988. The concern here, the issue is that, in a crisis, if somebody is having chest pains, a family member, the person themselves having chest pains as well as a family member are despite the crisis, are likely to remember that 911 is the number to call. The concern is that with a 10-digit number, as well utilized as it has been, that in a moment of crisis, that a family member or a person themselves may not remember 1-800-273-8255, but that we hope to be able to get to the point where the number 988 would immediately come to mind. But to strengthen this capacity, SAMHSA recently designated $282 million to strengthen the National Suicide Prevention Lifeline. So there was a recent $105 million opportunity for states, and other funding went to the existing National Suicide Prevention Lifeline to strengthen the system of backup centers that we have, so that if a call cannot be answered within a couple of minutes locally, it automatically goes to a backup center. Also to strengthen the chat and text centers in our Spanish language subnetwork. You can move on to the next slide. And our hope is that, as is summarized in SAMHSA's National Guidelines for Behavioral Health Crisis Care, is to be able to move toward a coordinated system that starts, of course, with the person in crisis, access through the crisis line, but also has meaningful connections to a mobile crisis team, so that mental health staff can respond in those situations when somebody needs someone to come to them. And also access to crisis receiving and stabilization facilities as alternatives to the emergency room. Currently, many of our systems are really designed to drive people toward the emergency room, where they may have to wait a long period of time in order to be seen. And many of those people can have their needs met on the phone, or if it can't be met on the phone, that it can be met with a mobile crisis team. We also think that this can reduce reliance on the police and be able to respond to the person's mental health care needs, and also allow police to respond to critical public safety issues. You can go to the next slide. So, as I said, we are strengthening the existing infrastructure for the Lifeline as we transition to 988. We think this is an unprecedented opportunity to improve behavioral health crisis response and care for the nation. SAMHSA can't do this alone. We need partnerships from everyone and as we move forward. I also just wanted to mention that the funding availability that I mentioned before that went to states recently closed, but it was non-competitive. Every state was eligible, including the state of Maryland, which was eligible for $10 million. Those dollars are meant specifically to strengthen the hotlines within Maryland. There is other funding from SAMHSA, such as through the Mental Health Block Grant, that has a broader applicability. The crisis set aside for the Mental Health Block Grant, for example, can be used for hotlines for mobile crisis or for crisis receiving and stabilization. So as I said, SAMHSA can't do this alone. We need partners. We need this to be a strong federal state partnership. And of course, we could not do this without crisis centers like EveryMind, who are the backbone and have been the backbone for years of the National Suicide Prevention Lifeline. So I believe that's all I have, and hopefully I didn't go too far over time.
Thank you very much, Dr. McKeon, for delivering this informative keynote address. It is now my pleasure to introduce our next speaker, State Senator Malcolm Augustine, representing the residents of District 47, Prince George's County. Senator Augustine has been a member of the Maryland Senate since January 2019. He currently serves on several Senate committees, including the Finance Committee, Joint Committee on Children, Youth and Families, Legislative Black Caucus of Maryland, and he is an associate member of the Maryland Legislative Latino Caucus. His past Senate service includes the Joint Committee on Behavioral Health and Opioid Use Disorder. He has previously served on the board of Metro and as a prior member of the Prince George's County Democratic Central Committee. He served on the Ways and Means, Labor Relations, and Multicultural Outreach subcommittees. Welcome, Senator Augustine. Now over to you.
Thank you so very much. It's really an honor to be with everyone today. And I really want to just start simply by just saying thank you to all of the team members at EveryMind for saving the lives of Marylanders in crisis literally every day, every single day. I just really am just so thankful for that. As was mentioned, I was elected in 2018, started serving in 2019, and I identified behavioral health as an area that doesn't really get the headlines unless it's a tragedy, but it's just fundamental to Marylanders' ability to live their fullest lives. And I've been working with leaders throughout Maryland to help direct resources on all levels, federal, state, and local, to this most pressing behavioral health needs in our community. Along those lines, I sponsor significant behavioral health legislation that I'm really pleased that contributes to better behavioral health outcomes in Maryland. And that work continues with Senate Bill 241. And Senate Bill 241 establishes 988 as Maryland's behavioral health crisis hotline for mental health and substance use crises. It establishes a state fund to invest in 24/7 call centers, mobile crisis teams, crisis stabilization centers, and related crisis responses services. And it allocates an initial $10 million in 2022 to the fund to ensure that call centers are adequately staffed and available 24 hours, 7 days a week. I have to really thank Rachel Larkin, who is such an amazing resource with tremendous experience and knowledge serving our community. Rachel did an amazing job testifying at our hearing in support of the bill, and for that, I'm really very grateful. Now, as you know, mental health is one of the most historically underfunded health and human services in the country. It's absolutely staggering to me that some of our call centers in Maryland, like EveryMind, are only reimbursed as little as $700 a month for providing 24/7 phone and services like text, chat, and other services for the National Suicide Prevention Lifeline. Now, some receive a little more and others receive even less. Now, the COVID-19 pandemic, during this pandemic, we've been living through it for 2 years, and it's resulted in many of us living with this ongoing stress and trauma of isolation, illness, and loss. That mental health impact of the pandemic will be felt for years to come. And the true breadth and depth of the crisis will unfold over the coming years. 988 will play a vitally important role in meeting the increased demand for support during crisis and to prevent mental health challenges from even getting to a place of true crisis. Once 988 goes live, call volume to our hotlines is anticipated to triple. So we will definitely need to get prepared now. Now, creating that trust fund through Senate Bill 241 will be an important first step, but we can't stop there. We know that we will have to fund this long-term because it will help us with saving people's lives. Another thing to keep in mind is that 80 to 90% of calls into hotlines across the state really end up with helping people to prevent the crisis, which I'm just always so pleased about. And that they calm those people down because they are trained hotline specialists. And that's kind of the ongoing part that's happening with 988 within the hotline that is already there. So securing these funds for 988 will actually really be funding direct mental health services. Now, unlike 911, which connects you to a service, 988 is the service. And the call specialist is the frontline worker doing this life-sustaining work. Another reason to ensure Maryland's hotlines are funded is to sustain the additional volume is that call centers based locally are best positioned to understand our local need, know resources available nearby, and how and when to connect a caller to accessible services and help. And furthermore, hotlines also reduce emergency response and therefore hospital costs to local governments. That helps us to utilize our resources more efficiently. Now, just to underscore what Congressman Trone said, equitable access to mental health care is so important. Hotlines are equitable because they are no cost to the client, and specialists are trained and exceedingly knowledgeable in issues that may be specific to specific segments of our community. For example, specialists with experience serving our LGBTQ+ community, and culturally competent specialists with experience serving our racially and ethnically diverse communities as well. And people can reach out in the way they are most comfortable: phone, text, or chat. There's also an ongoing need to destigmatize mental illness. So again, these hotlines play a role in that destigmatizing because it can be 100% anonymous. Now, hotlines are based in local communities and understand what's happening at the ground level. They are aware of local sensitivities and the significance of local events that cause trauma to specific communities. So they are best positioned to serve those communities. Now, I must share with you that you may have seen in the news recently, there was the passing of the mayor of Hyattsville, Kevin Ward, who was a friend of mine. And we are a community in grief. Now, he took his own life, and we are absolutely a community in grief. Now, at every opportunity, the leaders of our community, including myself, have shared the 1-800 crisis hotline number to make accessible care to all. And we try to reiterate, and just to reiterate what Mr. McKeon said in his remarks, though, that number is a little difficult, honestly, to remember, particularly when you're in a crisis. Now, circumstances notwithstanding, I am really looking forward to sharing 988 as an easy to remember number for those in emotional and mental crises. But the work of 988, as you all know, is just not new. This work has been done by the National Suicide Prevention Lifeline call centers for 20 years. Some hotlines like EveryMind, which answers Lifeline calls, have been doing this for over 50 years. As a legislator, I think that it is always important to learn from those boots on the ground, the organizations who are delivering the services, because the ideas and solutions will come from them as they have carried out this work day after day, tirelessly for decades. And I encourage my legislative colleagues to do the same. So during the panel discussion, we'll listen closely to those who actually do the work, so we can understand the challenges around 988 implementation. And EveryMind and other nonprofits and call centers doing the work of saving lives need to be at the table. We need to listen and support. Long-term funding will ensure 988 service is accessible and able to fully meet the escalating needs of Marylanders in mental health and emotional crises. And our current legislation will facilitate that next crucial step. The crisis hotline and call center work done for 988 is an integral part of building back our communities as we recover from the pandemic. In the interest of all Marylanders and those in the National Capital Region, we need to do all we can to support successful implementation of 988. Sustainable funding is key to that. Now, folks, it is now my real honor to pass it on to one of my colleagues in this work at the county level, and that is Montgomery County Council President Gabe Albornoz. Gabe is a lifelong resident of Montgomery County and is deeply committed to the county and its residents. In November 2018, Council President Albornoz was elected to the Montgomery County Council as an at-large member, representing more than 1 million county residents. He currently serves, as I mentioned, as the council's president and chairs the Health and Human Services Committee, where he oversees public health and human services that impact children, adults, and seniors in Montgomery County. Council President Albanaz also serves on the Public Safety Committee, which reviews policies for first responders to provide first-class resources to the county police, the Department of Fire, Rescue, paramedics, and emergency operators. Now, I turn it over to you, Council President Albanaz.
Wow, thank you so much, Senator Augustine, and thank you for your leadership. I just want to say that we are all mourning with you. Public officials and legislators across the country have faced an just paralleled stress these last 2 years. And we know that the work of EveryMind and all of our behavioral health specialists have never been more important than it is right now. So thank you for those pointed remarks, and we stand with you and your entire community in these really challenging times. And they have been extraordinarily challenging times, unprecedented in so many different ways. But I want to begin by acknowledging the incredible work of EveryMind, which for generations has been providing literally a lifeline to county residents of all different generations, ethnic and cultural backgrounds, sexual orientation. And what we have faced these last 2 years has cut across every socioeconomic group in our community. And the numbers are stark. And that's why it is critically important for us to be able to implement 988 in a way that meets this moment, in a way that addresses the many concerns and feelings that we are sensing out in our community right now, but must be done in an effective way. And that's why today's panel is so important, to hear from providers who are directly or on the ground providing these services and who can help guide all of us to ensure that 988 is not just properly resourced, but that it has the runway and the support that it needs to be able to be implemented effectively. I want to note that Montgomery County has been providing support for over 50 years by funding the hotline that we have had here in Montgomery County that is so ably and so well managed by EveryMind. And I'll note also, as Senator Augustine mentioned, that it helps destigmatize mental illness because it is 100% anonymous. And it's not a secret that we are having a national crisis right now in the shortage of mental health professionals, which is an extraordinary challenge to meet this moment right now. And that's why 988 and other call hotlines are so important, because it helps leverage resources more effectively. As was noted earlier, we've seen an unprecedented impact on our children and youth here in our community. In fact, in fiscal year 21, over 66% of the text messages and chats that have called into our crisis line have been people between the ages of 10 and 24, and over 10% of the calls that have come into the hotline have been in that category as well. And so as legislators, we have to make sure that we're doing everything that we can to not just stand up this hotline, but to ensure that we provide the appropriate level of support so that when referrals are made to corresponding community-based organizations or Department of Health and Human Services, they're properly resourced as well. And I appreciate that we have connected our federal, state, and local partners to this discussion, because we have to continue to work cohesively and collaboratively to address the myriad of needs that have arisen across our country. In a moment, you're going to hear from my good friend, Congressman Jamie Raskin, who has been a leader at the national level on this issue, and whose pointed conversation and discussion about how this has impacted his family has really touched all of us in a way that is so profound and so deep and so authentic and so needed for us to elevate this issue at the national level, destigmatize this, but also make sure that there is no wrong door, that we're providing support all the way around. So I'm honored to be speaking on behalf of all of my colleagues on the County Council and expressing our total and complete commitment to this work. It has never been more important than right now, and we have to get it right. So with that, thank you so much for allowing me to speak this morning.
Thank you so much, Senator Augustine and Council President Albanaz. Your passion, dedication to us and the work we do really helps us save lives on a daily basis. And we could not do it without you. So thank you so much. Getting to work with passionate people that believe in this is one of the benefits of my job. So like what I like to do right now is introduce the panel of my fellow hotline directors. We're going to address a few questions from the start, and then we're going to have a lot more time at the end because we've had so many great questions come in. But I'd like to have my panelists join me. They have been my colleagues for many years. I am honored to get to work with them. And if you guys, I'll call your name, and if you would briefly introduce yourself and your organization, and then we'll get to the questions. So let's start with Quinetta Garrett.
Good morning. My name is Quinetta Garrett, and I am the Director of Hotline Services for the Here to Help line in Baltimore City with Baltimore Crisis Response.
Thank you. Tim Jansen.
Good morning, everybody. I'm Tim Jansen. I'm the CEO at Community Crisis Services in Prince George's County. We operate a variety of hotlines in Prince George's County, across the state of Maryland, and nationally. Thanks for having us today.
And Susie Borg.
Good morning. I'm Susie Borg. I'm the Crisis Services Director at the Mental Health Association in Frederick County. Thank you.
Well, Susie, let's start with you. Can you tell us about the experience of centers currently answering calls about suicide?
Sure. Thanks, Rachel. I think I've been watching some of the questions come in, and I think there's a whole lot of confusion. So this is a really great time, I think, to talk about that. And that we're talking about a new number, a new way to access services that have been around for a really long time. In fact, the call centers that have been answering the national line and will be answering 988 have over 150 years, probably even longer than that, of combined experience answering a lot of different types of crisis calls. So we handle a lot of different things at each of the centers. Each of those centers answer multiple lines. We answer state lines, national lines, local lines, and some of those have specific focuses. For instance, our center on the Eastern Shore answers domestic violence calls as well, as does Tim's shop. So there's a lot of different types of experience with these centers. We all have national accreditation as well. And 6 of these centers specifically are accredited by the American Association of Suicidology. And have been for many, many years. Most of our centers also answered the predecessor for the current National Suicide Line. Some people may remember many years ago, 1-800-SUICIDE. And that has turned into the national line that we know today. So we have lots of years of experience with those callers who have thoughts of suicide. Our staff have hours of training in suicide prevention best practices, and we're able to resolve, as was mentioned a little bit earlier, about 90% of the calls that are coming in regarding suicide. We are that front line, as was mentioned by Senator Augustine. Maryland centers have been at the forefront of suicide prevention since 1990, when the Maryland Crisis Line became active. And we're really excited about the new way that callers will be able to access all the services that our call centers offer.
Thank you so much, Susie. Well, speaking of the new way to access it, Tim, can you tell us what the difference between 911, 988, 211, and 211 press 1 is?
Absolutely. So as you're all familiar with, 911 is your call to emergency services when there's a crime being committed, when there's somebody in medical distress or mental health distress that requires an immediate response, somebody who can be there very, very significantly and quickly. Lots of demographics are collected so that folks can be pinpointed and services delivered very, very quickly. 988 is a movement of a 10-digit number that's been in existence for 15 years, 16 years, 17 years, actually. I've been around a long time. That really takes that 10-digit number so that people don't have to remember a 10-digit number because it's too hard. 1-800-SUICIDE actually still works, and it's still routed through the National Lifeline now. 988 will be an opportunity for people to reach out who are in crisis, who are in mental health need, who can talk with somebody about how they might stay safe, what they might need. As has been mentioned, as Susie said, about 90% of our calls are finished at the telephonic stage. We do lots of follow-ups to make sure that people are following safety plans. and making sure that folks are connected with resources and have the ability to, provide some feedback about the service. 211 is your connection to information and referral about community resources, shelters, food assistance, rent assistance, those sorts of things. 211 Press 1 is the 3-digit incarnation of the Maryland Crisis Hotline. The Maryland Crisis Hotline, which Susie mentioned, began in 1990, was the first decentralized hotline in the country. And the Lifeline and its predecessor are largely based on that infrastructure. So about 4 years ago or 5 years ago, the state decided that the 1-800-422-0009 was too hard to remember, and they wanted a vanity number. There wasn't a good vanity number, and at the time there was a law that said, or there still is, it says you need to work with 211. So 211 Press 1 provides very similar services to 988 and is answered by most of the shops that used to take calls from 988. So those are some of the things that are the differences. When you call 211 Press 1, you're going to get generally a Lifeline Center. We all sort of do the same thing. But 988 provides that easy to remember opportunity to access services that have been there in my shop for 50 years, in your shop for 50 years, Rachel, and in 30 plus in many of the other centers across the state.
Thanks so much, Tim. Kunita, can you tell us a little bit why it's so important for consumers that the services we provide are confidential?
Sure. It provides consumers with a sense of privacy and respect. It brings that sense of control back to the situation, I believe, especially for people who feel like they've completely lost control. It feels secure knowing that their situation won't become public knowledge. I think it's comforting for people to speak to a counselor who's non-judgmental on the other end and feel that they can express whatever they want and receive confidential support. It also feels secure knowing that this won't affect their job or their interpersonal relationships, because stigma, both internal and external, is still very real. People are often concerned about how they'll be viewed. Many hotlines receive calls from consumers for a variety of concerns, from mental health concerns, suicidal thoughts, divorce, financial issues, school concerns, and just a host of other issues. And I think it provides them with a relief knowing that they can receive confidential support related to issues that are still very stigmatized. I know there are callers who call into, who have our direct hotline number, but actually call through Lifeline because Lifeline advertises free and confidential support. So it's just, I think it just provides a sense of comfort, just knowing that their personal issues or their concern won't be spread around their community. Many callers say it's hard for them to call into the hotline and to be vulnerable with their issues and concerns. And it's just an extra level of comfort and support when they know that they're going to call and receive confidential support. And a lot of the times it's people's first time actually picking up the phone. And I think knowing that everything will remain confidential helps them seek help.
Well, thank you so much. I know we have so many more great questions, and you guys are going to have an opportunity to talk to more of these experts a little bit more later. But now it's my pleasure to introduce Congressman Jamie Raskin, who proudly represents Maryland's 8th Congressional District. Congressman Raskin was sworn into his 3rd term on January 3rd, and his district includes Montgomery, Carroll, and Frederick counties. He is in his 3rd term serving in the House Judiciary Committee, the Committee on Oversight and Reform, and the Committee on House Administration. This is his 2nd term serving on the Rules Committee and the Coronavirus Select Subcommittee. He was also renamed chair of the Oversight Subcommittee on Civil Rights and Civil Liberties and chair of the Rules Subcommittee on Expedited Procedures for the 117th Congress. Prior to his time in Congress, Congressman Raskin was the 3-term state senator in Maryland, and for over 25 years was a professor of constitutional law at American University. He has authored several books, most recently the New York Times bestseller Unthinkable, where he describes leading the impeachment effort against the former president shortly after his son's death by suicide, and the January 6th insurrection at the Capitol. Congressman Raskin is a graduate of Harvard College and Harvard Law School. We welcome you warmly, Congressman. Now over to you.
All right. Thank you so much, Rachel. Can you guys hear me now?
Yes.
Yeah, oh, good. Okay, great. I wasn't sure if I was in. It's been very uplifting and reassuring to hear all of the experts in the actual machinery of suicide prevention and in this movement to help our people. So I'm just gratified to be part of it and to be able to just say a couple of words of encouragement. As Gabe Albernas said, we're living in a time of a lot of trauma, a lot of grief, a lot of mental and emotional health problems. And the silver lining to it, perhaps, is that a lot of the stigma seems to be draining away, because if a majority of the people are experiencing anxiety or depression or other symptoms, it's hard to stigmatize it. I suppose that's the silver lining. That's the good news. The bad news is that the volume of people, the mass of people, is just growing all the time. And I'm so glad about 988 and the streamlining, simplifying, centralizing dynamics that are taking place in terms of the network of responders. So this is awesome. And we need to let everybody know that they are not lonely and isolated in their journeys, but there are people who are with them, and we are here to help them. And then in a proactive sense, I think we need to be doing the things to uplift everybody's emotional and mental health together, because each of us is on a personal odyssey, and yet everybody's emotional and mental health connects with everybody else's. And we've been living in a time of such dreary public discourse with racism and anti-Semitism and sexism and cruelty and bitterness and division and polarization. And our movement is opposed to all of that. We want to create a community and a society that is safe for people's feelings. And of course, I'm fighting against a political discourse which is based on lies and propaganda and conspiracy theory and basically divorcing people from reality. That's a dangerous thing to do, as all of you know. We want people to be grounded in reality. We want them to know that there are solutions to their problems and we can work this out together. So thank you for being so much on the front lines of this struggle to save our people from drowning in despondency and depression. We can rescue people from this. And so I want to thank all of you who've devoted your lives and careers to this important and noble cause. And thank you for generally trying to uplift the quality of our common life together. So that's all I've got to say. I am here with you. My door is always open. We're going to be fighting at the federal level, of course, to get the resources out there to strengthen all of our community mental health efforts. We want to try to make a real investment in K through 12 education, so people are getting the help they need early on, long before a crisis evolves. And we've got a lot of legislative efforts to try to improve our responsiveness and our intervention at young ages in the school context. So thanks for what you're doing, and I will yield back to you.
Thank you so much, Congressman Raskin, for joining us today and sharing your perspective and insight. I'd also like to thank all of our speakers today, Congressman David Trone, Maryland State Senator Malcolm Augustine, Montgomery County Council President Gabe Albernos, and our keynote speaker, Dr. Richard McKeon of SAMHSA. And a special thanks also to our panelists and moderator, Rachel Larkin, Quinita Garrett, Susie Borg, and Tim Jansen. EveryMind would also like to acknowledge all of our community partners in this work, many of whom are on this call today. Thank you for being our partners. We couldn't do this without you. And last, but certainly not least, a very special thank you to all of EveryMind's hotline specialists and the hotline specialists working with our partner call centers across the state of Maryland. You truly are the anonymous and often unacknowledged frontline heroes carrying out this important work every hour of every day. Thank you so much for everything that you do. We hope that all of you that have joined us today have learned about 988 and the upcoming challenges with its implementation. We'd like for you to walk away with the following 3 calls to action from after this legislative briefing. First, support legislation to resource 988 and hotlines across the state. As we've heard from Senator Augustine, the 988 Trust Fund legislation has been introduced. So we need to continue to advocate that 988 gets the funding needed to keep our hotlines thriving across Maryland. Second, let's work together to prevent suicide. Share 988 as a resource far and wide. The service, as you all have heard, has been around for 20 years, and we know it's working, and it's accessible and free. As our CEO, Ann Mazer, mentioned at the beginning of today's program, hotlines are as much of a resource to help prevent crises as they are about providing crisis intervention. So please help us ensure that everyone in our community and across the great state of Maryland, and especially our children and youth, know that hotlines are here for them to provide a listening ear when they are down before they might even get to the point of a crisis. They can reach out however they are comfortable, by phone, text, or chat. And third, get to know your local call center, support their wraparound work, and help build out all of our call centers to meet the growing needs of our community. All 8 centers throughout the state, as you all have heard, are doing amazing work. Get to know the one that's local to you. Support them with the services that they offer by asking what you can do to help them grow to meet the increased demand from our community, whether that's through volunteering, helping with securing funding, or something else. Let's commit to working together to ensure hotline services are sustainably funded and resourced so that they can continue providing life-saving services to our community for years to come. Now we're going to transition to the Q&A portion of this morning's program. So if you have any questions for our panelists, they are now available to answer them. As you have been doing, please enter the questions into the Q&A. Thank you so much to everyone for joining us. Thank you to our incredible lineup of speakers. We're so grateful for you for sharing your thoughtful insight and perspective. And now I'm going to pass it back to Rachel, Quinita, Susie, and Tim to begin the Q&A session. Thank you. Back to you all.
Thank you so much, Karishma. Really appreciate your kind words. We got a lot of questions before the briefing began, and I want to start with one about funding. And I think a lot of people don't realize the cost of hotlines. Not only do we have to pay for the frontline folks, we have a lot of we need to pay for a lot of supervisors to support folks who might have trauma. We have to pay lots of phone bills. Text and chat is particularly cost heavy because they last about 45 minutes to an hour each, and they have a lot more, they're more heavily suicide related. So I would like to whatever panelists would like to answer, talk a little bit more about the funding issues and what's going on with Maryland, and will there be more funding to support call specialists and the services that we provide on a daily basis? Anybody who want to jump in?
Sure. So on a daily basis, we provide a variety of opportunities to anyone who calls, chats, or texts. That can be simple support. That can be connection to community and local resources. That can be helping someone with critical crises ranging from domestic violence to homelessness to financial difficulty to suicide to child abuse. We work with callers, we work within their own values, we work to be culturally competent and culturally aware. We are able to do things in a variety of languages. My organization has bilingual Spanish speakers 24 hours a day, 7 days a week. All of our centers to be accredited by the organizations that we're accredited by must have a language solution. So many of us use a language interpreter line. And those work okay. It's always better when you're speaking with someone, one-on-one in your direct language. So, so folks, take whatever time is needed. We start where the caller is. All the services are non-judgmental. Folks can call about anything. They can be anonymous. It's confidential unless they're a danger to themselves or others. It's super important, as Quinita mentioned earlier, that folks have the opportunity to pick up the phone anonymously and confidentially and just sort of put their toe in the water to see what it looks like and to see that the water is calm and things are safe, and we're going to be supportive and helpful as they fight the stigma and everything surrounding needing mental health help.
Thanks, Tim. We had another question about peers, and I know that our hotline has a great deal of specialists with lived experience. Susie, Quinita, do you guys use peers or refer to peers?
We do. We have a lot of people on answering our line as well who have lived experience. We also partner here locally with our health department to have a peer on staff in our agency. And then we also have another way to connect with peers through a program that is offered here in our community. So when we have callers that can benefit from that, we do our best to make sure they're getting connected to that and that they're aware of those services that exist. That's really important for people.
Thank you. We had a question about call routing. Will people be routed to the nearest center, or how that's going to work? Anybody want to take that one on?
Sure. Calls will be routed to the nearest call center. The Vibrant, the organization that oversees the National Suicide Prevention Lifeline, is constantly working to make sure that folks are connected to the closest crisis center with a counselor available. In Maryland, we have a significant tree where we support each other. So Rachel's shop supports my shop, and then Susie's shop supports Rachel's shop. And et cetera, across the state, so that folks in Maryland generally get a Maryland center. The other really good thing about Lifeline services in Maryland right now is two of us, Quinita's center and my center, are also national backup centers. So if there were a Maryland caller that didn't get connected in the 3 minutes they have at the center they'd come to one of us. So we're really benefiting because we serve both of those opportunities. Is it possible that you could get a center outside the state? Yes. That would depend on availability of counselors and all of those sorts of things. As Rachel mentioned earlier, and I think you heard some of our other speakers talk about, this service is horrifically underfunded. And so we are providing this service on the backs of multiple grants and multiple funders and doing the very best we can to meet people where they are. But literally, it's pennies a call. Which doesn't come close. Even if you're using all volunteers, it doesn't pay for itself. But the routing is consistently updated so that they are working towards making sure you get the closest crisis center possible.
Thanks so much, Tim. Quinita, could you talk a little bit about how we work with therapists, and therapists can market and use us as a referral?
Sure. Therapists often call into our hotlines more often than not for support for themselves, for support for their clients. We encourage them to give out information to all of their clients. I know I'm assuming it's for all of us, but we encourage them to give our cards, our business cards, our pamphlets to all of their clients to call when they are experiencing any type of crisis, especially when they can't reach their therapist. So we do a ton of outreach across Maryland to agencies, outpatient facilities, so that we can provide information about our hotline for the therapist. So we are always encouraging therapists to work with us, to refer to us, and to encourage their clients to use our line when possible.
Thank you. There's a question about whether Maryland needs additional call centers. Susie, do you think you can take that one on?
Maryland is one of the few states that really is covered so well in the current structure. And so going into this transition to 988, we've been positioned really well because we already have 8 centers in our state. 6 that are, 7 that are main centers, 1 that's a backup. And we're doing a pretty good job right now of handling that. So we believe that supporting the existing infrastructure will allow us to continue to serve Maryland very effectively with the centers that we have.
Thank you. There's a question about the cell phone fee. Can somebody explain that and what's going on with Maryland? I think that's actually a really good segue into the legislation that we've been talking about a lot today. Tim, Quinita, anybody, or I can?
So the cell phone fee is one of the ways that states around the country are looking at ultimately funding the service. Right now, the service is benefiting from SAMHSA funds, federal funds. Some states are passing fees or creating legislation to pay for it. There is talk ultimately of there being a small cell phone fee, and we're talking pennies on a phone. We're not talking, $9 or anything like that, to ultimately make sure that this service is available to everybody as they can move forward. In the short run, there is funding, probably not enough. And we'll see if the projections on call growth and call volume actually come to fruition. But that's ultimately what it looks like. One of the pieces of legislation in front of the Maryland legislature right now is a bill to support a trust fund or a fund for setup and operation of 988 for $10 million. And that will significantly help the centers make sure that training is complete and supervisors are on and calls are answered. The new key performance indicators are intense. The Lifeline is looking for 95% of all calls to be answered in 20 seconds. Currently, their KPI is 80% of calls within 2 minutes. So you can imagine the funding that it takes to get there. But ultimately, there is going to need to be a mechanism that this gets paid for.
And that's where everybody attending today can really help. You can reach out to your delegates and your state representatives and ask them to support this bill. If you want, you can reach out to me. And there is the Fund 988, Maryland 988 has a template that you can use, that you can just upload your thoughts on this bill directly to the legislature. And I'll be happy to get that to anybody. If you want, just reach out to me after the briefing. But that's a simple thing. It can take you 5 minutes, and that could really make a difference to all the centers in the state of Maryland. It can make a difference to all the people in your community, because it'll give us the opportunity to hire more folks and reach more people locally. The next question is something that I'm going to address because it is about the CAHOOTS model. And that's a Montgomery County model. So the question is, will the CAHOOTS model affect the operation of 988? So 988 is actually run from the National Suicide Prevention Lifeline. And it is the centers that answer it are chosen and are run by overseen by Lifeline. So the state and the county doesn't have a choice about who's answering 988. It's the centers that are already part of the Lifeline network that are answering. But with that being said, we work very closely with Montgomery County. We have wonderful partners at the county and state level, and the county is definitely integrating us into the response that they have. So we are working with fire and rescue, talking about how to, when they get a caller from somebody with mental health issues, how to triage that, right? So they had somebody the other day who had a panic attack, declined an ambulance. So 911, handed them off to us, and we spent 20 minutes helping them calm down and having skills in place for having it again if they have another one. And then they also working very closely with our partners at the Crisis Center, who are fantastic. And that's who, once we talk with somebody, if they want mobile crisis team to come out, we warm transfer to them. So while CAHOOTS is we're working within the CAHOOTS model, but the 988 centers themselves are kind of, we're part of the Lifeline network, and that's what determines. And that also sort of answers another question we had about, do we want to add additional centers that Susie got to earlier? Okay, lots of questions flying in. Will veterans still need to press 1 to get the Veterans Crisis Line? Okay, everybody's shaking their head, so that is a yes. But we do work very closely. We get lots of training on veterans. We have lots of veterans resources from Maryland. So if somebody doesn't choose to press 1, they still get a really informed response, and we can transfer them back after we've sort of talked with them. A couple questions about that.
Yeah, and the Veterans Crisis Line has an answer rate of like 99.7% within 10 seconds. So when you press 1 after dialing, the lifeline, you get to somebody pretty darn quickly.
So this is an interesting question. I'll put it out there. How are we going to address the shortage of mental health professionals?
So that if you can answer that, you can write your ticket as a billionaire, because everybody in the country, maybe world, needs to know that. One of the challenges is that Lifeline centers are not staffed by mental health professionals. They are trained by expertly trained crisis counselors who go through 80 plus hours of training on crisis intervention and listening skills and suicide prevention and intervention and all kinds of things. The challenge is 988 starts opening the door for people for mental health. Who do we refer them to, and how do we do that? And so that's something that we need to be asking everybody, is how do we figure out how to address the shortage of mental health professionals, because that's going to affect the system down the line. The challenge for 988 is, who do we link to? Community mental health centers can have long waiting lines. Mobile crisis teams will have urgent care appointments, but they have to reach a certain level. And all that sort of stuff. So there are lots of opportunities for that discussion. Fortunately for 988 centers, you don't have to have a master's degree or a license, to work on the line. So that doesn't mean we're not struggling to find people, because we certainly are, because, I say this to people all the time, I'm not paying much more than people say, hey, do you want fries with that? And there's no stress in that, and there are no lives on the line, just asking about, what you want for lunch. So, I noticed in the chat, increased pay, increased benefits. We're all working on that diligently, and trying to make these positions very, very sort of awesome to the people that are looking at them.
And I want to piggyback on that. I'm sorry, Tizi, go ahead.
No, I was just going to say, I would add to that, back to kind of what Richard presented about the overall view, forward look as to what crisis services are going to look like and what 988 is going to be part of, right? Right now, we're talking about the call centers. We're talking about that function. We're talking about really shoring up that foundation that we already have in all of the different call centers that we have, because that's going to be your first line. But then it's also working in our communities to develop more crisis services, more different types of response. So, yes, when somebody needs somebody to call, there's always somebody there to answer. But if we need somebody who can go out, or we need somewhere that we can go, we have those options too. And so we know our state and our community is really working on that. And I think the next several years, we're just going to see a really different look of crisis services. And it's really kind of exciting to be part of that transition. We've all been doing this for a really, really long time. And just to see this happening now, it's exciting. There's more to do for sure. And getting people connected and the things that we can do while they're waiting, right? We have that ability to do follow-up calls. We have that ability to kind of connect with them. Some of our communities have walk-in crisis that can kind of fill a gap. Some of our communities have crisis stabilization centers that are kind of looking, mobile crisis teams. There are ways that we can kind of work with someone, but a lot of times a person with thoughts of suicide won't pursue that ongoing mental health. Not saying they don't need to, but that may not be what they choose to. So what we can do in that moment to help plan for safety is really, really critical.
Thank you.
This is want to say too.
I'm sorry. Go ahead. No, go ahead. Yeah.
It's just important also for us to just think about ways as far as like retention and recruiting staff and supporting hotline counselors, because they hear some really stressful calls back to back. It's a really intense job, and it wears a lot on their mental health. So just and I think for retention is really just about finding ways to support them as well.
Actually, Kunita, that's such a good point, because a lot of the funding we get, people want to pay for the front line, the butts in the seats. which is great. But your point is so important, because we need the managers, we need the supervisors, because they're the ones that are on call. They're the ones that are supporting that person, like Terry in the initial story, so that when she gets off that call, her mental health is okay. So we need more of that support that isn't just for the butts in the seats. Thank you. Here's a good question. What is the difference between warm lines and hotlines, or more specifically, warm lines and 988?
I don't know that there's a really big difference. And I think it really matters. Warm lines, which a lot of times are peer staffed, are great resources in our communities, and the communities that have them, it's really possible that we can do warm transfers to them. We can do that. But a lot of the work that we do, that we're trained to do, right? We do supportive listening, we do crisis intervention, we do suicide prevention, we do information referral. We kind of fulfill that function. So a lot of what we are doing now and will continue to do is that work of a warm line, or and to be part of that recovery process. So in the communities that have those warm lines and have that additional layer of support, that's great. But in the communities that don't have them, our regional call centers can handle that function.
Thank you. A deeper dive into the funding question. Is the proposed funding to be used for creating 988 infrastructure, delivery of services, delivery of care, or all the above?
Depends on the source. But yes, it's mostly all the above. SAMHSA has put some money forward. There was money in the American Rescue Act for all of the above. And so there is some money coming this year and into next year for those sorts of things. They generally don't know what we need. And they generally underestimate the cost of what we need. What Quinita and Rachel, and I'm sure Susie would say, is it's great to pay for the call takers, but call takers need to be supervised and trained and coached and supported and all of those sorts of things. I'm 3 levels removed from call center folk. I had folks calling me this week going, "Hi, I had a tough call, I need to talk." And I'm like, sure. I'm always here to do that. And so we need those opportunities because, and RuPaul stole this from me. If you can't take care of yourself, you got no business taking care of anybody else. I've been saying that for 25 years. RuPaul owes me a trademark.
Thank you, Tim. There's a great question. Just wondering if there'd be any opportunity to partner with universities and college to offer training and internships as suicide prevention call chat specialists in an effort to cast a larger net for recruiting and overall awareness that doesn't seem to exist in most upper education and mental health programs. I'll address that, and if anybody else wants to as well. I know that we are working closely. We've been out to Montgomery College just this week. We are speaking at University of Maryland later this month, and we love having young folks work in lines, and especially for me on chat and text, they're some of the best folks, chat and text specialists, because they can understand the lingo a lot more than somebody my age can. I'm not saying that we can't, but they're really great resources. And like was said earlier, you don't have to have a degree to do this job, because our training is so intense. You get everything you need to really support people when you get through this training.
We love students, right? We do. And as Rachel said, it is such a great training ground. One of the things that I've seen in the chat is several people saying, I've been in a program, I didn't get that. Tim and I both say we both did our master's programs, and we learned very, very little, if anything, about suicide. And Tim learned what he learned because he taught it. And so that happens a lot, but it's such a great opportunity and skill building. And the number of call specialists that we've had that come through our center that did hotline work and then have now gone further in the field, who are now fully licensed and in private practice or doing other types of crisis work. And I will even give a shout out to EveryMind, because I have a therapist on staff now because she got trained at the EveryMind call center, and it's truly a great opportunity. We love students.
Yes, we do. Quinita, Tim, do you want to add anything to that one?
Yes, I agree.
Yeah, no, go ahead.
No, I agree with everybody. We encourage students to partner with the crisis, or the universities to partner with the crisis centers, because you will get the best experience. As Susie stated, you really don't learn this in your master's program, how to de-escalate, how to work with a person who's in a suicidal crisis. So you really get that hands-on experience. We don't necessarily have students on our hotline, but we do a ton of trainings for the universities. But I think it's awesome to partner.
Yeah, we do trainings with universities and lots of different schools. We also have a bunch of student interns, either bachelor's level or master's level folks, that go through our training process and then are on the lines, either chat and text or on the hotline. And it never ceases to amaze me that 2 years after they graduate, I get a call, oh my God, I can't tell you how valuable that was and how much I use those skills every day. One of the beautiful things happening right now for students is if they're working for a qualified nonprofit, they can get some significant deferment on student loans and payment of. So there are some significant benefits for students that come to work for us. So send them our way.
Here's another question. Do 988 services get any money from health insurance? Nope. Well, let's talk about that, because I think what's important is, yes, we can't get money from health insurance, but it is, I think, goes back to the confidentiality. When you call 988, we do not spend 20 minutes gathering data on you. We don't ask you your last name. We don't ask you, race and ethnicity questions. We don't ask even your gender unless you want to tell us. And because of that, because we don't have all that, we're not billing insurance, but it gives you a great deal of confidentiality and anonymity. And we just hear what you want us to hear, and we serve you based on that. So I think it makes it difficult for us to bill because of that, but it gives a much more robust experience to the consumer. Okay, question about repeat callers. How are repeat callers dealt with?
For us, it really depends. We do have some callers who use us as their daily support. So what we do is we develop a care plan with them. And it really just depends on what type of support they need. We always do our original safety assessment, but some people just call daily because they have no other supports, or the hotline maybe is the only thing that they know. So we develop a care plan with them, and the care plan, it really just depends on their needs, but we always do our safety assessment with that person. We do try to connect them to services, but everyone who calls the hotline does not want a service. They may only want the hotline. So it really just depends on the person, but we do receive repeat callers.
I saw a question pop up in chat real quick about the charges. So just to clarify, the 988 charge that would be on your cell phone bill, if you look closely now on your cell phone bill, you get charged, I don't know, like $1.25 a month for 911. Whether you use 911 or not, that you get charged that every month to support 911 services. So what they're talking about, the cell phone charge, is not if you're using 988, you get charged for it, but everybody in the whole state who's got a cell phone will pay like 25 cents or $1 each month to support the services across the state, so that they're available for you should you need to use them. But you won't get charged like per call. Just wanted to clarify that one. Question, I have my feet in multiple jurisdictions. I currently live in DC, work in Montgomery, and just purchased a home in Anne Arundel. Please talk about how this will make the hotline support accessible or equal quality across our region. 988.
So all the 988 centers are required to have policies that are approved by Vibrant for service delivery. All of the centers that will be answering 988 are also required to be accredited by either the American Association of Suicidology, the International Council for Helplines, CARF. There are a couple others that folks can use. Those accreditations ensure a certain minimum standard across jurisdictions. Now, can it be different? Absolutely. Whether if you're calling in DC, the 988 center is run by a government office. In Maryland, they are all nonprofits. They're mostly nonprofits, a couple for-profits. So there might be a difference in terms of information they may ask to collect, nothing is required, or in terms of who's answering the line. But they all have to meet those standards. They all have to be trained appropriately in all the things we've talked about. And then there are those minimum standards they all need to meet.
Thank you. What resources exist for family members who fear that self-harm behavior and depression in a teen may lead a loved one may lead to suicide?
I think that's one of the types of calls that we get quite a bit, right? Is somebody who's concerned about somebody else and what can they do? And so we offer, just a level of psychoeducation to them about what to look for, what to expect, what are the services. And a lot of times what we're educating people on, what, it's okay to ask. Like, you won't know, you'll be worried, you won't know the answer, but it's okay to ask. And here's a good way to ask, right? To kind of give that information. And then sometimes it's here, the phone gets passed here, you talk to them, right? And so we're able to do that. In some cases, we're able to make a outgoing call and choose that person that they're worried about. So there's lots of different things that I think we're able to do when somebody reaches out to just kind of assure them a little bit, along with follow-up calls. How are things going? How's that going? Is there anything else that you need? Making sure that they're getting what they need.
And encouraging training like mental health first aid for youth, Safe Talk, Assist. The Yellow Ribbon Campaign has a training. The American Foundation for Suicide Prevention has some trainings. And so, being abreast of all the best practice kinds of trainings that we can share with folks. Rachel's shop and my shop do a lot of mental health first aid. All of us do some Assist stuff. Many of us do some Safe Talk stuff. There are a lot of different sort of, there's QPR. There are lots of different best practice sorts of trainings that we can recommend to folks.
Well, I want to thank the three of you so much. It's been an honor to work with you for more than 15 years. We're not dating you, Kunina. The rest of us, we've been around forever. But truly, your passion and dedication are an inspiration on a daily basis. So I want to wrap up and thank all of you who have joined us today for being here, because this is something that is so important for our communities. I want to wrap with a quick story about why the work we do is so important. A while back, I was on call and I received a call from one of our best specialists, and she was on a chat with a young person who was struggling. And she was having trouble with him because he had said in the pre-chat survey that he was suicidal. He had also shared that he had Asperger's, and his responses to her, every time she asked him something, was trying to do a suicide screening, were like 100 questions back and were kind of a little bit aggressive. And so she was having a trouble sort of really connecting with him. I scrolled through the chat and I noticed that he mentioned that he wrote heavy metal lyrics, and I encouraged her to explore that. And through that, he actually started cutting and pasting his heavy metal lyrics into the chat. And she started picking out lines that really expressed his emotion in a way that he was having trouble doing so, typing on his own. He really opened up. And, it turns out he was very low risk for suicide. He didn't have any strong intent. He had no plan. He was just frustrated and feeling lonely because he couldn't get across what he needed to say. The specialist encouraged him to print out the chat. He did. He printed out the chat, one for his father and one for the specialist he worked with at his school. And at the end, and he was not the kind of, we get chats all the time that end with, thank you so much, you saved my life tonight. And we knew that based on his conversation, that was not how he was going to end this chat. But he said, I'm really glad you finally understood me. And that was like the best compliment of all, because this is somebody who's been struggling so hard to be understood. And that is why the work we do is so important. We are available at 2:00 in the morning to talk to somebody who can't say the words out loud. We are there when, somebody just needs to hear a friendly voice. We make such a difference. And now we need you. It's your turn to help us and be our supporters. Next slide. And you can do that again by talking about 988 in your community. The more people who know about it are the more people who can use it. And again, reaching out to your legislators and telling them to support us. We cannot thank you enough for being here today. If you have any further questions, you can reach out to me. Also, if you go to the National Suicide Prevention Lifeline website, you can find your local center. So look up and find who is serving you and reach out to them. And if you want to volunteer, we will take your volunteers. If you want to donate, we would love your donations. And if you just want to learn more and how we can partner with you in the community, we are happy to do that. So thank you so much for being here today. Again, you will be able to access this recording. It'll be posted later and you'll get a follow-up email. And then you can also get the slides as well. Thank you so much. It is an honor to share what we do with you on every day. And thank you.